President Trump's One Big Beautiful Bill makes its way through Congress. It could have major impact here in East Tennessee. While the bill passed in the House last month, it is still up to the Senate to see if it makes its way to the president's desk. 6 on Your Side reporter Naomi Hillmer joins us now with more on what we could expect here at home. Naomi.
Lori, in talking to a local political expert today, they told me we could see this bill impact us in a variety of ways. If it passes, he says some people could be bringing home more money, but it could be at the expense of others trying to get access to health care or other federally funded programs.
Even though it might have a more official name in Congress, the Big Beautiful Bill is the President Trump's and the Trump administration's attempt to try to put all of their domestic agenda into one bill, including both a series of cuts on government spending in more than a few areas, and then also to try to continue the tax cuts that the Trump administration put through in Trump 1.0 during 2017.
According to political science professor Mark O'Gorman, the bill could help hourly and service workers, as it will remove taxes on things like tips and overtime pay.
The argument is that a wait staff could actually take more and bring more home in their pocket because the taxes on the tips don't occur. They haven't got it figured out so much. They still have to deal with their hourly salary, but maybe they can keep literally more, if not all, of their tip money.
While some people would be able to take home more money each year, O'Gorman says the cuts they plan to make on federal spending, specifically on social programs, could have a major impact here and across the country.
If Medicaid is cut, there's already estimates that are saying not just in Tennessee, but nationwide, you could have literally well over 12 million people losing their Medicaid insurance nationally, including, I haven't heard the number in Tennessee, but I'm sure a general guess, tens of thousands of people either drastically reduce or losing their Medicaid funding.
And while the bill would restrict access to programs like Medicaid and SNAP benefits, he says it could negatively impact people who are already struggling.
And then the question becomes, how are they going to get health care? And since that health care is going to come out of their pocket, you're going to see, even though it attempts to reduce government, you will see a significant and negative impact on people who are of lower means financially in terms of how they're going to get health care from year to year.
While this bill focuses on government spending, there are a number of other things the bill could impact as well. But in talking to O'Gorman today, he tells me access to health care and the potential to take home more money on tips, especially for those who rely on them, could be the biggest impact felt here. Lori?
All right, Naomi, thank you. And he also tells us despite the president's push to have this bill signed by the 4th of July, it could take a while for senators to settle on a vote.